So hi, I'm Dr. Sunil Richardson. So today we have this patient who's undergone a lot of stuff in her life for a condition called as hemangioma or arteriovenous malformation. She's had multiple interventions in different Indian cities for the last 2 decades, and she's come here to us now for the first time. I've taken her scans. I'm going to show you her current scenario, and I'm also going to explain to you how I'm going to solve this problem for her. Right. So hemangioma, first of all, is a condition which involves the blood vessels, or the lesion involving the blood. Okay, open one. Yeah, and you can show it. See the tongue to start with. Tongue. Look at that. Almost 50% of the tongue is involved. It's just crossing the midline at the tip. Otherwise, it doesn't cross the midline. It's going all the way to the base. I cannot see the posterior extent. I'm going to show you that on the scan. Upar karo. Also here, you see it's, and I'm going to show you how vascular this is. So the moment I press, you see that it's getting filled up. I think you can appreciate the vascularity of the lesion. This is after she's had multiple surgeries and a lot of injections. It's still a vascular lesion. Yes, it hurts her a little bit, so I'm sorry. Okay, and then you see here, the lesion then extends onto the lip and more inside on the cheeks. Look at that. You can see it extending to the cheek and all the way up to the lower jaw. Okay, band karo. Now I'm going to show you some scars from her earlier surgery. There's one here. There's a large one here. And there's still a lesion sitting here. ऐसे करो थोड़ा बड़ा होता है ना ऐसे करने से. Yeah, so when she puts her face towards the right side, the cheek swells up as well because of flow to that area increases. You can see this now. And I'm going to just squeeze that out and it's gone. See that? And now you can see it coming back. It's there now. When I squeeze it, the blood just disappears. I can feel the blood filling in and filling out. And it's quite a high flow here. So anyway, there's a lesion that's there. It also comes down here. So the lesion is pretty much extending from the base of the ear, half of the neck, under the chin, onto the lips, and from this way from submental region onto the tongue. Okay, so that's the clinical presentation. She also has some small calcifications that I can feel. We call them pleboliths. This has been there for patients who have this kind of a problem for a long time. I'm going to show you her scans now. Next up, both her MR angio and a cone beam and CD, and then we can make a plan. Okay, right. Bite, move band karo. All right, she doesn't have proper occlusion as well, and but of course that's not our primary concern now. Our primary concern is to solve her of this lesion. Interesting one. Look at this. It's like bullets. 1, 2, 3. A large one here. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. I can see about 15 of them. These are all pleboliths. Now let's move on to the cone beam for her. Look at that. They look like going around the sun or something. They look like some planets. One large one, 2, 3, 4, 5, 6, 7, 8, 9. All of these are pleboliths, and you can also see them from this view. I'm just trying to show you in a better view. I think this is probably the best view. But you can see it's around the entire region. So this is all the, I'm going to show you now. I'll try to show you the size of this plebolith. I'm going to measure them out for you. Okay, you can see them coming up. Look at that. 1, 2, 3. Look at this. This is a normal ramus, and you can see these pleboliths coming there. And I'm going to show you the size. That one is 7 millimeters, and this one is almost 5. You can see 4 there in one go. As I move, there's one right here. Look at that one. This is very, very close to the midline. That's about 6 millimeters again, pretty large one. Okay. And now we're free of, that's the upper jaw now. So I'm probably going to go down more lower and see, yes, there's one coming up. Then there's another one here, another one there. This is the largest one that we've been seeing on the CBCT 3D also. So let's measure that out. 8 millimeters, almost 7.3 millimeters. That's the size of the largest plebolith. Many more, right? Okay, so that's quite an interesting finding because we don't see so many pleboliths in a patient with arteriovenous malformation. Look at this, she has one right here also. This is under the tongue. And this one is again 6 millimeters by dimension. Plebolith. Lith is a stone. Plebo mean blood. So pleboliths refer to any calcifications that are seen in the blood. That's what plebolith is all about. Now it's very rare to have so many pleboliths in the same patient of this dimension, and it's not really something that grows. So it's not something we have to really take only the pleboliths out. But when I remove the hemangioma or when we clear the malformation, these stones, these calcifications also must be removed. Some of the patients, even her, she has pain, especially when you palpate or when she's around these stones, around these pleboliths. So that's one of the reasons why it should go. Now these are complicated, challenging cases. I'm planning to do the debulking for her, the removal of these lesions in 2 stages. Because everything is connected for her. The tongue, the posterior tongue, the lip, the chin, the cheek, and the posterior mandible. It's all connected through lots of networks. I'm going to show you on the MR angio how the system is connected with the vasculature, with the blood. So I have to make them into pockets and make sure I remove one at a time, making sure that particular thing is healed for life and doesn't recur, and also at the same time making sure there is no complication, there's no major risk. So that's the plan. And they've just come for a consultation. So I've worked them up now. We've done all the scans, I've done the MR angio, I've seen her. I'm probably going to give them an appointment a couple of weeks or a month later when we're going to plan the surgery. So this is the MR angio of this patient I'm just discussing. So you can see the vasculature. You can also see the pleboliths inside. I'll show you here. This was done in another city, but you can still appreciate the excess of vasculature in this part, which is a problem. You can see how it's dense here, and that shows that there is so much of blood flow. Entire region, which I was telling you that there's a connection from the tongue to the lip, and from the lip onto the cheek, and so on and so forth. This very beautifully brings that out to us. So that's why I'm going to make pockets and take segments of this out so that she doesn't have any problem. And this is the report which was given at that time, and I'm going to show you some alarming thing. So it says 4 into 6.5 into 6.3. That's because they've done the measurements here. But you know what? Apart from this size, there is also the lesion that's even bigger than that. I'm going to show you what. Look at this. Multifocal infiltrative type of non-hypervascular enhancing lesion. Right submandibular, parapharyngeal. It's going all the dimensions. So it's going into the masticator, sublingual, epiglottis, tonsils, uvula, pretty much the entire area that I told you. That's the extent of this lesion we're dealing with. And have a look at the findings on the MR angio once more. You can clearly see the difference between the normal side and the affected side and all the cuts. तुम रूम जाओ, जब ब्रदर आएगा ना वो पैकेट लेके आओ, ठीक है? ये तुम्हारा है। फिर तुम आपको बताएगा खून के बारे में क्या क्या करना है, सब कुछ। ब्रदर के साथ आओ।